It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
So my friends, it's getting close. November 3rd is getting close, and I know you're probably as frustrated as anyone else in the country is about this election and what's going on, et cetera, et cetera. Purpose of the show is always to bring facts to you, particularly my friends, the senior citizens who get dumped on, lied to, cheated on all the time. And so we're on the road to getting information out. Today we have Tarah Toohil, who is the current legislator for the 116th Legislative District. She's looking for re-election. She's no stranger to the Sam Lesante Show. Tarah, how are you?
I'm very well. Thanks for having me.
Crazy, crazy things happening in our lives today, aren't they?
The pandemic world has just been so difficult for all of the families out there. It's just been a time like no other in our lives that we've experienced with the economy and the health of our citizens.
More than ever, I think, Tarah, and this is well over my 4,000th show. More than ever, I think it's so important for people who are in office, who are running for office, to be honest, okay? And I know that's such a terrible thing for some people because they lie all the time just to get in office. They'll say anything they want to say. They'll lie to senior citizens. We heard it with Governor Rendell when he promises property taxes were being eliminated, and he lied to everybody. Nothing ever happened from those. Seniors are still paying the property tax. Seniors are still paying school tax.
Right.
Okay.
Right.
And you live with that all the time because they swamp you with that. When you ran for office, you told your constituents you were going to do certain things. What did you tell them and what did you do?
So the #1 issue with property taxes has been that every time that I can vote for property tax relief, I've done so. And one of our problems is other legislators won't vote for that because they don't have property tax problems in their district. So I'm one of the main co-sponsors of the bill for over the age of 65 that you would no longer have property taxes. It's unfair for seniors, and they should not be funding the school district. They should not be funding education. And also the fact that our properties here, many of them are not as high enough of a tax rate that adequately funds education. So in the Hazleton Area School District, we're underfunded because of the property values. So that's something I've fought for and something I continue to fight for. And one of the other issues is there are talks of you'd have to raise the personal income tax in order to take that tax away from senior citizens. And some state representatives also don't want to vote for that. So that's been where the logjam's been.
So how do you overcome that?
So I think that you do have to hold people accountable in their districts. It's something that I'm willing to vote for. So the working people don't really want to have more of a personal income tax, but at the same time, they're more likely to have children in school. So there's a fairness element to that. And we want our children to have the best education possible. And we also don't want our seniors out there suffering the way that they do with their property taxes. Especially what we see in the office is when your spouse dies, you only have one Social Security income then, and that's what really triggers losing your home. One thing that's been excellent for the seniors out there is prescription drug costs in the last year because of President Trump and everything federally. They have gone way down. So we used to have, that's really alleviated a lot because we were in the best economy we've ever had, and he was working on the prescription drug problem. So that was positive, at least for us here in Pennsylvania and for our seniors.
For some of the ads that you hear, you would never believe that he did that, you know.
Right. It's been adopted by other people trying to take credit for that, but
well, that's
it's been a
typical,
success.
It's just...
And so another huge success that we've had in my time in office is crime. Crime in the city of Hazleton was up 70%. And a lot of that was because my predecessor had allowed a private prison to come in with state funding to come in on Broad Street, right down here on Broad Street. And so I was able to get the funding cut on that. That was a really heavy lift. I had to put a lot of work into that, and and fight for that very hard. And so we were able to close that private prison.
So you're talking about the person who's running against you now was the person that voted for?
Yes, that allowed the state money to go in and fund a private prison where we had 185 criminals, and they would come out on day release and just ravage our town. Yeah. We had purse snatchings, rapes, burglaries. Our crime was at the highest it's ever been. And so that is one of the huge successes that we've had. And we were able to do that in my first 2 years in office, in my first term.
Now, there was many other accomplishments, I know, because as you come on the show, you give us an update. Now, the biggest concern, and I think Dr. Valent put it the best when he was on the show with Mr. John Fletcher. He said, we do not have a book on COVID-19. We do not know, so we're learning a lot of things. And fortunately, unfortunately, while you're learning things, you got to do things like, well, first they told you about the mask. Okay, then they said, Fauci says, you don't have to worry about the mask because when you're talking, the particles, blah, blah, blah. Then they said you got to wear the mask. Then they started telling you social distance. Now they have complete control of our lives. They tell you what to do, how to do it, where to go. They've destroyed families. They're doing everything they possibly can to destroy, in my opinion, Tarah. So now you come up as a legislator, you took great action. Okay,
yes.
I mean, they're facts. I mean,
yes.
I'm not just, you took definite action as to let's address this. So when the COVID-19 thing, what did you do to prepare us for this?
So on March 15th, right away, we convened Mary Malone from the Greater Hazleton Chamber of Commerce and myself, and we created the Greater Hazleton Area COVID-19 Task Force. And we thought we have to centralize all of our information. We have to figure out what's going on in our community. And right away, because we have a lot of people that come back and forth from New York, and New York was a hot spot, we started showing that the Hazleton area was going to be a hot spot. So we were able to convene daily with Lehigh Valley Hazleton Hospital. We were able to talk to them about what our needs are. They opened up testing sites. So a big part of fighting the coronavirus and keeping your numbers down is having testing, and not just testing on positive, like symptomatic individuals that feel sick, but testing the population so you can weed out who has the virus and find out how is the virus spreading. So that data is really important, and the testing is really important. So Senator Yudichak, he helped us. We worked in a bipartisan fashion with our community, because we would call the governor's office. I myself would call frequently and say, I have thousands of employees in industrial plants, and they are having more spread than other parts of our community. And the governor's office would not help us. They would not touch large corporations. So you have thousands of people going into big box stores and industrial plants, and the governor would not touch them. But at the same time, then he turns around and he closes all the mom and pops, the small garden and tree shops, so you'd have to go to a big box store, and you could go to their garden center where thousands of other people are shopping, but you couldn't support small local businesses. So that was one of my biggest fights right from the beginning, was the focus was all wrong. The focus, we were asking for less people to go into the big box stores, and because of our advocacy and myself calling and saying, you have people crowded in Walmart, you have people crowded in the grocery stores, and they weren't taking any of the precautions. So we were able to get it. So then remember, they had the lines outside, you weren't allowed to all go in at once. So we had to be whistleblowers on a lot of that right away. So our task force met with the hospital daily. We went over our daily numbers. We worked with Mayor Cassatt. We worked with our city council woman, Lauren Sacco. Everyone was involved. This community came together like you've never seen before. And I was able to lead it with the task force so that we worked, United Way, we divided up the tasks. We knew we needed housing, quarantine housing. We were worried about, at that point in the beginning of the pandemic, we were worried that people were going to be falling dead in the street, literally. And so, that we would run out of hospital beds. we would run out of ventilators. And so we've had amazing successes because those things did not happen. And that's something that our community should be very proud of how everyone came together and worked together for the common good, to keep people healthy and to keep our numbers down.
So testing is always the key. Okay, so let's talk about, you hear the surge, and when people hear the surge,
it's scary. It's a lot of fear mongering.
Well, it's 90% of it's fear mongering. I mean, because here, you're in a situation, all right, that you got to wear that mask where you're at, okay, because you're the state representative. Now,
and I want to keep, I have to tell people,
Yeah.
because people want to hug you.
Yeah.
They want to shake your hand.
Yeah.
And they're telling us hand washing is very important.
Yes.
Flu season at church, they tell people don't shake hands at church.
Yeah.
Don't give peace at church, because the virus, we know that viruses spread. It's on your hand and you're going to transfer it to someone else. And so I think right now the numbers are going up a little bit here in our area because people have COVID fatigue. They're also so focused on the mask that they're not focused on the hand washing or wiping down surfaces. Right now, the statewide numbers are showing that the spread is coming from family gatherings, like small family gatherings, where because you let your guard down, people are hugging, people are less likely to wear a mask. So small family gatherings are driving it, and they also think shopping and not being careful about shopping. But restaurants are not, and we could talk about that later, but restaurants are not being seen as the driver of COVID-19 right now.
Well, you mentioned something about children who had died in the state of Pennsylvania. So, before I go, let's talk about the nursing homes, all right?
Yes.
Okay, so we have the nursing homes here. And again, Tarah, you just said that you're trying to get information from the governor's office, all right? And you're a state legislator, and you're having difficulty getting facts. Okay?
Correct.
Now, isn't that so sad? In the state of Pennsylvania, you have a governor, Tom Wolf, and his Secretary of Health, Levine, who are not allowing you, now correct me if I'm wrong, to get the information that you need so you could pass on to your constituents, okay?
Right.
So my other question is, why? I think politics, okay? Then I think about the fact that nursing homes where Levine takes her mother out of the nursing home, okay, and until everything's fine, and then brings her back. Is that a fact?
I don't know if she ever actually went back to the nursing home.
Okay.
She did take her mother out and then kept her at the Hershey Hotel,
Okay.
which she had insider information that I'm not privy to, and she was scared enough for her mother and is,
And these are the same
of an economic bracket that she could take her mother out and put her at the Hershey Hotel. So that really was very unfair. We knew from the beginning that people 65 and over are at greater risk, and also people that are in nursing homes and personal care facilities are at greater risk.
They have the nursing homes and assisting living homes so petrified, okay, so petrified that, and they're doing what has to be done, all right? But let's talk about the cause and effect here, okay? So you're looking at children who have died from COVID in the state of Pennsylvania. How many?
So we have that 3 children have passed away from COVID-19.
Okay.
And in a normal year from the flu season, we have 46 children. So in 2018, 46 children died of the flu. And it's sad, it's terrible,
Absolutely.
but that's the regular flu that we have, where you have to hand wash and you have to be careful, and it does happen that vulnerable die. So we've actually had more children die of the flu in 2018 and possibly in this last year, but I didn't have the breakdown. They didn't give me the breakdown of numbers, but the number of children that have passed away because of COVID-19 since the pandemic has been 3 children. And meanwhile, every school is, many schools are closed. Teachers are in schools, children are not in schools. And there's 3 children that died of COVID, but there's 986 children since the pandemic, since March 15th until 2 days ago, that have actually died of other causes. So that's child abuse, neglect, it's going to be car accidents, influenza, and other diseases. So we really have to, I had to do a right to know request to get that information. And I'm a legislator and I need access to that so I can make policy. It can drive your policy and drive smart decisions.
And that's why he wants more of his Democrat friends in, okay? Because if you put them in, he's going to be able to do whatever he wants to do. And here again, and if it was reversed, if he was Republican, he'd be saying the same thing. And people are buying it, okay? Hopefully, not everyone's buying it.
It is important. So for the viewers out there, if you've been unhappy with what's gone on to your right to own a business, your right to open a business, your right as free citizens to go out and go shopping, you can wear a mask, you can wash your hands, you can go out and still support the Pennsylvania economy and still be safe. So if you're out there and you're like, what is going on with Pennsylvania? Why are we the most locked down, the most quarantined, and yet we still have the most deaths? Why is this? You do want to have public officials when you go and vote that are going to question what the governor's doing. Because everyone's saying, get rid of the governor. Like everybody that I come in contact with says things like that. And I would say like 90% of the people. And they have to know the people that you're electing have to be people that ask for transparency, ask to know what is going on, and are going to fight to let us be open and live in this new normalcy and still try to be safe about it.
You are a very strong pro-life person. We're doing a show now on pro-life, which I actually showed aborted children. And it seems people could care less whether a person's pro-choice. Kill as many babies you want, that doesn't make any difference to me. And these are most times Catholics, hypocrites as far as I'm concerned. That's my personal opinion. You and pro-life, okay, now when everything closed, okay, and he made sure that everything was closed, he made sure one thing was open.
Yes.
The baby killers places, okay? He made sure if you wanted an abortion, Governor Wolf was allowing you to go wherever you want, and they weren't closed. Tell me about that.
So this is one of the most upsetting things to me. We were able to get the information that when everything was closed, the mom and pop stores were closed, pediatricians were closed, you can't go to the dentist, you couldn't see your doctor, you couldn't have any regular appointments. Many people have died of cancer, undetected, missed appointments. There's that whole other side to the coronavirus. And we've had 18,000 children, 18,000 unborn babies that have been aborted in Pennsylvania alone since March 15th. So that is because when the governor closed everything, he still kept abortion facilities at full tilt. And they're mainly in African American communities. And so you have a higher proportion of African American unborn babies, Latino unborn babies that are being aborted. So there's a whole issue there. And for the 18,000 babies that were not given a chance at life, there is one, for every baby, there are 36 families that are out there waiting to adopt a child. So because I'm such a huge adoption advocate, that is something that, there are families out there, there's other choices that can be made, and it's really horrifying and disgusting that it was essential and life-sustaining, because it's certainly not life-sustaining unless it's someone that, those cases, it's very rare that someone is having a circumstance of rape or that the mother is actually going to die if she gives birth. So that was not the circumstance for these 18,000 unborn babies in Pennsylvania. And that's what's gone on since March 15th. And even if you are someone that believes in choice, you can look at those numbers and say there is something really wrong with those numbers and how they target African American and low income communities. The
destruction they're doing for these females, it's a destruction. There's so many cases of mental anxiety after and et cetera. And there's, like you said, there's so many people want to adopt children.
There's so much support out there where that doesn't have to be
happen.
the case.
Tarah.
So the unborn children and then the senior citizens in the nursing
Well,
homes,
see,
it's not
yeah.
hasn't been a respect of life from,
well,
from cradle to grave. Like, you have to respect life, and it has not been that during this pandemic.
And the interesting thing is the fact that, seniors are concerned about surviving. The whole thing about trying to pay their bills, et cetera. And then, sometimes some seniors say, well, the abortion issue, yes, but, I'm not going to have a baby. But however, there's such a thing called euthanasia. When you're sick and you're unwanted, what happens to you? Biden will continue on with abortions. Kamala Harris said that she'll have abortions on demand. So we have all of these things that are so, in my opinion, I don't know, seniors should be very much concerned about that, Tara. Wouldn't you think so?
Right. I think because it's about how you're treating people from the beginning of their life to the end of their life. And so our seniors right now, things are getting a little bit better in the nursing homes.
Yes.
So they've opened it now. So really, I think you have to just make personal decisions. Be careful when people are really trying to scare you to stay in your house.
It's every day.
Yeah, but we do want, if you're an at-risk individual and you have other health conditions,
How many?
your family can, there's help out there. People will volunteer. They'll drop food to you if you're afraid to go out.
So how many cases, even though the cases are going up, how many deaths are happening, and what are the symptoms? It's like flu or cold. I'm not downplaying it by no means, okay?
Right.
But the point is that, you were told they're going to drop dead. Como had the ships coming in and everything. And rightly so. I mean, you had to prepare. Like Valent said, we don't have a book on this, so we have to do what we have to do. Hopefully the vaccine will come out soon, and that'll really give us a big help. I want to move on. What is the biggest concern? I know the answer, but of your constituents right now. What are they concerned about, Tara?
So they're very concerned about the economy. They're very concerned about their freedoms and where we're going in America, as well as where we're going here in Pennsylvania. And people are losing their American dream, that's for sure. They're losing their businesses that are never going to reopen. But one of the issue right now is election integrity. People are panicked about their mail-in ballots. And I mean, that mail-in ballot is very important. You have to send it, when you do send it back, you have to send it back with the secrecy envelope. So I've had people calling, they've already mailed it back, and then they see the extra white envelope. You had to have that secrecy envelope. So if that's happened to you, you need to correct it right away. Call the Elections Bureau. You can go vote in person at the Elections Bureau. And we also have just people that are throwing away the mail-in ballot. You're supposed to if you don't want to vote by mail, you're supposed to bring that with you to the poll and give it to them and show it to them. So there's a lot of questions.
Well, Dave Pedri was just on my show, and he went over that in detail.
Okay. Good.
So I mean, he explained about Luzerne County and how it's safe it is. What would you do differently from what the governor is doing right now in the way he's handling the pandemic?
So we voted, with the election, we voted to allow 3 days early to start opening up the ballots, because that's a problem the county said, not to count them, but just to do the physical manual labor. So we're really in jeopardy because we don't have the workforce and the manpower just the pure labor that goes into it. It's a problem because we want to get our results as soon as possible. We were supposed to be using electronic machines. Mail-in ballots were never looked at to ever be in this quantity that we're having right now during pandemic times. So that's a problem, getting results back quick, not having any chaos, and not having Pennsylvania be a national spectacle, or Luzerne County. But right now with the governor, we've been in a fight. Yesterday, we've been in a fight for months. On July 15th, the governor came and just on a whim, he said, in 12 hours, you have to roll back your restaurant, and you're not going to be, you have to be 25% capacity. You have to serve food with it. You can't just go have a drink at a restaurant. There has to be food on the table, and you cannot sit at a bar. And many people sit by themselves at a bar, or just two people sit at the bar together. So immediately when he did that on July 15th, there were Pennsylvania workers that lost their job. They lost their job the next day. There are restaurants that have had to close bars that have had to close. So it's really, the restaurant industry is such a huge part of small business in Pennsylvania. So it's just wrong that the governor has done that. I've voted to remove those restrictions. The data, as we said, has shown that restaurants are the cleanest place to go. The restaurants and bars, they clean everything off. The wait staff wears masks, and you're very protected. And the spread is not coming from restaurants and bars. So also, we've had many owners that their bar has been closed, but you still have to pay the state license fees. And so that's been something else. I wrote letters and I was denied by the Pennsylvania Liquor Control Board. Tim Holden is somebody we know well in this area, former Congressman Holden. He's the chairman. They told me they don't have the authority to roll back those liquor license fees that I was trying to help the small businesses with. And yesterday now the governor proposed that he is going to roll back the fees on the licenses. So it's just, I was told by the Liquor Control Board themselves that they do not have the authority to do that. But the governor's meeting with them this week, and they're going to try to do what I've been asking for since May.
It seems your opponent here is claiming a lot of things that you've done, okay, from what I'm seeing, okay, was brought to my attention. Is that true?
So the things that he's saying that he's done, he has definitely not done. And what I can tell you, the contrast between us is that I will never abandon this community. I'm very proud to be able to work here and serve this community. And I've always been a part of this community. And I certainly would never abandon us. And I voted for pay freezes on all government officials. And in contrast, he's voted a 16% pay raise for himself in the midnight pay raise scandal. Also, he has, I didn't take a state car. I gave that up when I came into office. I never took a taxpayer-funded state car. I thought that was wrong. So the things that you're being told, or the person that you're being told and that's being projected is certainly not that person. And I think that you're all very smart. Everybody's got a long memory. The constituents out there, they're smart, they have a long memory, they remember. And my office, my staff in my office, they treat people with dignity. When you have to come and ask for help, when you're at your lowest point, when you are burdened with property taxes, my staff treats people with dignity, and they're respectful, and they're so proud and honored to serve the community. And that's something that we do. That's something I do, and my staff has been just fabulous and been a family to the constituents.
Tara, you got about a minute left. I want you to tell the viewers why they should re-elect you to be their state representative.
I am so proud and honored to serve this community. It's something that I never take for granted one single day. During this pandemic world has been the toughest time that all of us have endured. We've had the crash of the Pennsylvania economy, and we've had fear for the lives of our constituents. You in your homes have had fear, and we've gotten through that, and we've had significant success. And so I'm asking for you to stick with me and allow me to continue fighting for this community, lowering crime, and helping us have better health care, saving lives. And it's something I'm very proud to be able to do for this community, and I'm honored to continue to fight for all of us.
Well, I wish you and everyone else the very best of luck.
Thank you so much.
Folks, remember the facts. Don't be lied to. They're going to tell you anything just to get power. But you have to deal with facts. You want a doctor, you check him out or her out. You make sure the doctor is qualified. The doctor could have 17 million signs all over the place. Doesn't mean anything if they're not qualified. Signs are only good to refresh your memory of what the person did. That's what signs are for. And that's what I feel anyway. But please vote. It's very important, especially this year. Thanks, Tara.
Thank you so much.